Good morning. We are coming on the air to bring you live coverage of the public health press conference this morning. Let's go ahead and take you live as it looks like Megan Pearson has already taken the podium. Let's tune in.
Okay, thank you, Megan. This morning we are reporting 5 new COVID-related deaths and 44 new cases in Kern County. And then just very briefly on the Kingston healthcare facility, so I can provide you some updated information. The state has reported to us as of yesterday, there are 54 healthcare workers cumulative that have been tested positive. There's now 112 residents that have tested positive. That's again a cumulative number, and 18 residents that have died. At Valley Convalescent Hospital, the state is reporting to us as of yesterday also. There are 19 healthcare workers that have tested positive, again a cumulative number, 42 residents that have tested positive, and 5 residents that have died. And then finally, our skilled nursing facility testing program remains active. We have been at the Delano District Skilled Nursing Facility on June 2nd and 3rd. We tested 174 employees. We are at the Bakersfield Rehab Center this morning and Heights Street Skilled Nursing Facility this afternoon. And then we have 2 more scheduled for the rest of this week and then beginning of next week. Since May 15th, we have tested 626 skilled nursing facility employees. And with that, I'll turn it over to Megan.
All right, for a quick rundown on testing, we still have several test sites open. Of the state-funded sites, one of them has closed. So currently open are the Kern County Fairgrounds. The entrance on that is off of Ming Avenue and P. The Mojave Veterans Hall remains open, as well as the Arvin Public Health Building. The location, the drive-through location at the Richard Prado Center off of Mount Vernon, closed yesterday. We are currently looking for a new location to put that site. The county sites also remain open. We have the location in Oildale at the Good Sam Hospital, location in Taft at the Westside Healthcare District. Delano has the Adventist Health Delano Regional Medical Center. Kern River Valley is functioning at Kern Valley Hospital, and Ridgecrest Regional Hospital is testing as well. And then last we have Tehachapi Adventist Health. So for our Tehachapi residents who are interested in testing, that one is functioning as well. We have currently conducted over 5,500 tests at those sites and continue to look for additional sites as necessary as the communities have hotspots that we need to address. So now I'll bring up our Chief Administrative Officer, Ryan Alsop.
Thanks, Megan. Hello, good morning, everybody. Today in Kern County, the population 900,000 plus. The county has conducted over 30,000 tests of residents for COVID-19. It's 30,730 is the number. We've got 2,462, or about 8% of that total number of residents who have tested positive. We got 27,430 negative results of the 30,000 total tests that have been provided. As Matt mentioned, we've got 55 people today in the hospital. 7 of those are patients/residents of skilled nursing facilities. 45 total deaths, 24 of which are patients/residents at skilled nursing facilities. Of the 2,462 residents in our county that have tested positive for COVID-19, 2,361, or 96% of those, have either fully recovered or are recovering at home, treating their symptoms on their own. Quickly about reopening, most businesses in Kern County are reopening. We are working with them. The state has provided guidance for most industries. There are some remaining industries that are part of stage 3, which the governor has termed higher risk businesses for the spread of COVID. Those are businesses like bars, gyms, nail salons, public pools are in there. The governor has stated that he will allow Kern County to begin opening those businesses as soon as the state health officer publishes guidance for those businesses. Kern County, our team here is standing ready and awaiting that guidance. We have not been given that guidance yet from the state of California. As soon as we get that guidance, we will begin opening those businesses as quickly as possible under that state guidance. So with that, I'll be happy to answer any questions you have.
Okay, we'll follow our usual process. I'll call the outlet by name and then we'll take questions. Our first station is Kern Radio. Do we have anyone on the line with questions?
Yes, ma'am. It's Ralph Bailey from Kern Radio.
Go ahead, Ralph.
There is a story in today's New York Times where scientists are linking DNA to the disease. Basically, the type A blood type are more vulnerable. I'm reading from the New York Times. Having blood type A was linked to a 50% increase in the likelihood that a patient would need to go on a ventilator. Are you all clocking this, COVID patients, by blood type? And have you all seen any similar pattern?
So, Ralph, I believe that information would be traced by hospitals. We're going to have Kim Hernandez, our lead epidemiologist, respond to your question. So give it just a second.
Hi, Ralph. This is one of many things that we know CDC has been looking into. There has not been any specifics from CDC yet at this point that there is a higher risk in those groups. It's something that is still currently being evaluated. It is not something that is collected through public health surveillance, but it is something that is known at the hospitals. So we anticipate that CDC, when necessary, will be reaching out to the hospitals through us to get information like that as they continue to look into differences in patients with COVID-19. Thank you.
Thank you. And I have a question for Mr. Alsop. I have a source that is saying that the governor is going to open these bars up on Tuesday. Do you have any knowledge of that?
Hang on, Ralph.
No, Ralph, I don't, but we would welcome that and work with the state to begin opening those businesses as soon as we receive that guidance.
Thank you.
Okay, our next outlet is Channel 23. Do we have anyone on the line with questions? Okay. Kern Soul, do we have anyone on the line with questions? Our next outlet is the Mojave Desert News. Anyone on the line with questions? Okay, Channel 29. And I'm hoping you all remembered star 6 to unmute. This is going to go really quick. Channel 17. Anyone on the line with questions?
Forgot the star 6 from PGET.
There we go.
Hey, are we still on the right order?
Let me go back because I think we may have missed people on the star 6 option. So,
Okay.
Kern Soul. Anyone on the line? Mojave Desert News. Channel 29.
Hi, yeah, that was me. I apologize. I forgot
That's okay.
to start this. So it's Tim here from Channel 29. Got a couple quick questions for you guys. Obviously, we've seen protests here in response to George Floyd. Social distancing isn't always, being followed. Is there some concern among officials that could potentially lead to an increase in cases in 2 to 3 weeks? I know, especially last weekend, I think we had one day where we had like over 100 new cases, which for us was quite an increase in the daily spike. So how much concern is there among county officials and public health officials about, ramifications maybe in 2 weeks' time?
Thanks for your question, Tim. Matt from Public Health is going to address that.
Tim, good morning. Yes, we are concerned. In fact, we're concerned with any activity that potentially could increase those numbers and impact our hospitals. So as we have said with all types of activities, wearing a face covering is strongly recommended, especially when you can't keep that distance. So it will be interesting to watch as different industries open up, and if the protests have any impact to our numbers. But it's a good reminder that we all need to be cautious. No matter what our daily activities are, we need to be concerned and take all the actions we can. And again, you're not just protecting yourself, you're protecting your family, your children, your parents, your neighbors. So it's a responsibility that we all face. Tim, I hope that answers your question.
Yes. If, God forbid, we did see an increase in the cases going forward, is there ever a chance that we would actually go backwards in terms of steps of opening up, or are we committed to reopening and just kind of mitigating it as we go along?
So our hope and our intent is that the guidance documents that have been put out and the recommendations that the state have asked us to follow from churches and hair salons and restaurants will be sufficient to limit transmission within those industries. But yes, the state has told us very clearly that, especially as it relates to our variance attestation that we submitted and got approved, if we fail to consistently meet those requirements in that form, and our triggers continue to be exceeded, that is always something the state has held over us, that there is the potential that we may have to revert if we are exceeding our capabilities here, if our ICU beds are impacted and we don't have that capability to care for those in the future that are sick. So yes, that remains a threat for us when all of these different activities are occurring, but it's something we have to continue to monitor.
Thank you, Mr. Constantine. I have one more quick question, if it's allowed. And that's just, I know that obviously we're allowing elective procedures to go forward at our hospitals, but if I'm not mistaken, folks have to have a COVID test prior to getting that done. Have we seen a lot of those results come back positive for folks who might not even know they've been ill?
So Tim, you'd have to ask the hospitals themselves about their procedures. If anybody is found to be positive, we follow the same procedures we always do, regardless of where you live or where you work or where you're visiting. We would follow that same process. So you probably have to direct those conversations to the hospitals themselves, but I'm not aware of any impact that's had.
Okay, thank you guys.
Okay, I haven't noticed that we do have someone from Channel 23 on the line, so I'm going to go back. Remember, star 6 to unmute yourself. Do we have someone from 23 available?
Hello?
Yes, we can hear you.
Yeah, Austin with 23, thanks. I was wondering if people were protesting Friday, Saturday, about around when these protests really started to pick up, when should those people start to see symptoms? When would we start to see an uptick if there was one?
We'll have Matt address your question.
Good morning. So the incubation period is really between 2 to 14 days. So we're going to be looking for that range. Many of the symptoms develop within 7 days, but we use that 14-day period as a window. So we'll be watching that. As you've noticed, some of the guidance documents, even the church guidance documents, indicates that there's a 3-week window where the state has asked that attendance be limited because they too were tracking that time to see if there's any increase in cases.
Thank you, sir.
Okay, Channel 17, do we have anyone on the line?
Can you hear me?
I sure can. Go ahead.
Okay, it's Alex Fisher. So I know that the crisis in California and across the nation has really been focused on the skilled nursing facilities. And I know it's been a huge issue here at home, specifically between two skilled nursing facilities. And I feel like every time, we get new information, I know that this is a fluid situation. I know there's a lot of moving parts, but what is actively being done to stop the spread of coronavirus in these nursing facilities? And for the facilities that have not reported a case yet, what is being done to prevent those homes from becoming a hotspot?
Okay, thanks for the question, Alex.
Morning, Alex. It's a great question, and that's where the county has been dedicating a lot of their resources. It's really important to understand that skilled nursing facilities are regulated by the California Department of Public Health. They have the responsibility and the authority to ensure that our residents within those facilities are safe and cared for. I think this virus has shown that there are areas that need improvement, significant improvement. We have taken the unusual stance of really taking a lead role in something that is not the county's responsibility, but because we are concerned about the residents. You've seen some action recently from the board. They've designated a county skilled nursing facility person to audit and review their practices. We actually have daily meetings with the state on skilled nursing facilities. We actually ourselves then check in with the skilled nursing facilities. We have our skilled nursing facility testing program. We're trying to do everything we can, and in fact, staffing. We are the ones that try to obtain staffing for both, in particular, both Kingston and Valley Convalescent, so that we can shore up the staffing with local people that are willing to dedicate their time to support these facilities when they're struggling with adequate staffing. It's not enough. We need to do more. We're concerned that although we're dealing with Kingston and Valley Convalescent now, that there are other facilities. I mean, there's 19 total. This is not something that's specifically unique to those two. We are expecting it will affect others, but we need to do things now. We need to step in now as much as we can. Kim Hernandez, who's speaking today, was on a call yesterday with the skilled nursing facilities, specifically talking about actions they're taking. So we're involved. We're going to do everything we can, but it's important to understand our authority is limited and our experience with skilled nursing facility is also limited, and we're really asking the state to play more of an active role in protecting our residents. Thanks.
So is it safe to say that there is an equal balance of trying to prevent the spread of coronavirus in the active hotspots and trying to prevent a hotspot at the other facilities? Is there kind of an equal balance that the county and state are doing?
Yes, each one of these sites, each one of these skilled nursing facilities is permitted and inspected by the state. The state has asked each one of these facilities to put together a testing program and a mitigation program. We've actually asked for those documents ourselves so we could see them. So yes, it is a balance between focusing really on the ones that are struggling and where unfortunately some of our residents have passed away, to identifying earlier those that work in other sites that could be positive and maybe don't even know it yet, and that's why that testing program is active. We want to identify those, perhaps even those asymptomatic employees earlier on, so we can take actions to preclude them from coming to work and preclude them from actually infecting others. Hopefully that answers your question. Yeah.
Thank you. Our next outlet is KNZR. Do we have anyone on the line with questions? Okay. KUCZ, anyone on the line with questions? And our last outlet, the Bakersfield Californian, anyone online with questions?
Yeah, hi, this is Teddy Feinberg. Can you hear me with the
I
California?
can. Go ahead, Teddy.
I was wondering, and I believe this question's for Ryan. So Ralph asked about Tuesday in particular with moving on to stage 3. Is there any expectation or ballpark in terms of when we think we might be getting word, or is that just very hard to say right now?
I'll have Ryan respond to that.
Okay.
Yeah, it's hard to say. I did not hear Tuesday. Could be the day. I know that we are in the next several days are when we are expecting this guidance to come out. It may not be all of the guidance for stage 3 businesses all at once. It may be piecemeal. It may be guidance for bars one day, guidance for gyms the next day. We just don't know. What we do know is that the governor will allow Kern County, under the direction of our public health officer and public health team, to begin opening these businesses once we receive the guidance. And we will be working, in fact, we're working on it already, but we will be prepared to move as quickly as possible once we receive that guidance.
Thank you very much.
Okay, I'm going to pause for a second and ask if anyone has any additional questions before we conclude for the day.
Yeah, I've got one more question, Megan, if I could.
Go ahead.
This may be silly, but what is going on in our hospitals? You guys have any guess? Our hospitals are empty. It's got to be one of two things. You think if any industry wouldn't be impacted by anything, it's a hospital. If you're sick, you're sick. Are people staying home sick, or do we go to the hospital when maybe we don't need to?
So I'll have Matt respond to that question. I'm not sure anyone in this room is going to have a really good answer for you, Ralph, just because that would be a question for the hospitals to answer, and it's kind of speculation. So actually, Ryan's going to answer it.
Yeah, Ralph, I just wanted to come to the mic and congratulate you on your sports radio program every day. We appreciate that. Ralph, I'll just reiterate, we've had, and your question's probably good directed to hospital administrators, but we've had 30,730 residents to date who have been tested for COVID-19. 27,430 of those residents, of those tests, or 90% of those tests, have come back negative. I want to reiterate that of the 2,462 residents that have tested positive in our population, 2,361, or 96% of that number, have either fully recovered or are recovering at home, treating their symptoms on their own. So I think that is partly an answer to your question. But on the availability of space in hospitals and the businesses of those hospitals, probably should be directed to a hospital administrator.
Very good. Thank you.
Any other last questions before we conclude? Okay, that brings us to the end of our Thursday briefing, and we will be back next week with additional updates. Thank you.
And that concludes the live press conference from Kern Public Health this morning, reporting 5 new deaths among residents here in Kern County and over the past 24 hours. We're going to have more on the latest numbers from nursing homes and around the county coming up at 11 a.m. You can watch that live on our digital platforms. Thanks for joining us.